And so I'm Vishnu, as I said, I'm a member here. And with that, I want to move to actually welcoming our guests, Neetu and Jake, who've graciously taken the time. Thank you so much for joining and for spending your Tuesday evening with us.
Thanks for having us.
Thank you for having us.
Before we begin, I'd love to have both of you introduce yourselves, and I do request yourself, don't be modest. Tell us the real story of what you've done, because it's really, really impressive, and you're some hometown heroes. So Neetu, you want to tell us a little bit about yourself?
Hi, everyone. My name is Neetu, and I am right now working on a tiny little startup that hopefully will be not tiny eventually. But I'd like to tell you about how I got here. I studied computer science in college because I'm Indian, and my parents told me.
I get that.
What did they tell me?
I don't know, be an engineer or a doctor, right?
Perfect.
That's what it is, yeah.
Yes, that's exactly what they told me, because that's a requirement for being Indian child. So I studied computer science because my dad basically told me, go study that, and that will be the right financially secure future. I spent the first 18 years of my career at Microsoft. I worked on everything that is like small, tiny APIs to developer tools to enterprise software. And the last thing I did was Office 365, and I actually loved every bit of it. I didn't know what I liked when I got there at 21, but by the time I left, it was very much like, if it doesn't hurt, I don't like it. So continuing on that thread, I left Microsoft to go work at a startup, a tinier startup. I went from 90,000 company to 180 people company. That was quite an experience. I went from a full Microsoft stack to no Microsoft stack. That was also quite an experience. But we worked on organic marketing software for chief marketing officers. Near the end of that tenure, I actually got sick. My mom got sick, and experienced the healthcare system and just had a very giant reaction to how bad it was and how I didn't want to leave that for my children. So I figured I would take all of my skills and apply it to something that at least I could feel like I was doing right for the world. I tried to do a startup then, knew nothing, and it was a really bad idea at that time, so I stopped. I went and worked from Oscar Health. I was there for 3.5 years. During my time, I joined as a VP of engineering. I left as a CTO. I joined a private company. I left a public company. I joined a company that had 400,000 members. I left one that had 1.3 million members. And the team size was pretty large as well. So I absolutely loved my experience at Microsoft. It was like drinking from a fire hose every day for 3.5 years straight. And now I'm on to my new venture.
And we'd love to hear more once
Yes.
the time comes in the conversation to do that. Jake, please tell us about yourself.
Sure. Thank you for having me. It's nice to see everybody. So my name's Jake. I graduated from Cornell way back in the day. I guess it feels like way back in the day to me. When I graduated, I did, I think, what most people who don't know what they want to do, but who are reasonably ambitious do, which is I went and I worked on Wall Street. And so I spent a year on Wall Street and decided it wasn't for me. And from there, I forayed into the startup world. I bounced around a few different startups, and then in 2018, I sort of, what had been like low-grade anxiety turned into sort of a fever pitch. And what had been intermittent depression became not so intermittent. And my mom and dad, who are in the crowd, my mom's a therapist and my dad's a psychiatrist. And so given my own mental health struggles and my mental health background, it felt like it made sense to me to try to start a mental health company. And so that's what I did. 5 years ago, I started a company called Headway. The origin story is really both me and my co-founder respectively struggled to find a therapist that we could afford. It didn't make sense to us that we paid all this money for insurance, and yet none of the therapists accepted that insurance. And so we started by solving a problem that we individually respectively experienced. And it turns out that that was a problem that millions of people experienced. And that was really, like the last big chapter of my professional career. I spent 5 years at Headway. Today, it's a $1 billion company. There are probably 500 employees, helping close to 1 million people get access to care. And after 5 years, I decided it was time for something different. So I had given everything I had to Headway and convinced myself that it was time for something meaningfully different. So I left Headway and I took a hard left turn into teaching. So I became a 5th grade English teacher at a charter school in Brooklyn called Success Academy. And man, was that different from being a startup founder. I think it was a lot harder in ways that I couldn't have imagined. One of the things that I'm grateful for in the classroom was both the interactions I had with the kids, but also it gave me sort of a first row seat to the state of youth mental health. Kids in my class unanimously were struggling with behavioral health conditions, and there was a near uniform lack of access to care. And so I actually decided to leave the classroom in June to work on youth mental health. So like Neetu, I'm also working on a new business. It's as early as can be. I started it with one of my former co-founders from Headway. We just raised a little bit of money. We're looking for great engineers. So if there are folks in the crowd who are interested in learning more, I'd be happy to chat with you after this. But yeah, that's a little bit about me.
Wow, fantastic personal stories, fantastic professional stories, and I'm so excited to dive in with both of you about that. What we're going to do for this evening is spend about 40 minutes with questions that we've mutually agreed upon, and then I will turn it over to the audience for you all to ask a couple questions and share your perspectives. And so I want to start first by talking about tech and the healthcare system. It's often said that the healthcare system is probably the biggest industry that just hasn't had that same impact from everything else that's happening in our economy with respect to tech. And in the last 10 years, more than $30 billion has been invested in digital health and healthcare technology. And I want to ask you both, I'll start with Neetu first, what has that money done? How has that catalyst of venture funding and other forms of investment changed the healthcare system?
I think it has definitely changed the picture of what is possible. Several years ago when I tried to do this, people wouldn't even have a conversation with me about possibilities, and it wasn't just because I wasn't the CTO of Oscar before then. It was because nobody actually believed things were possible to be changed. Now, I think the amount of money flowing into it, amount of creativity and dedication that's flowing into it, you could argue quite a bit about what percentage of it is actually wasteful, but like Headway, like that's like a success story in my book, right? So I think now the dreams have gotten bigger, and the possibility and and options have gotten bigger. Even healthcare systems are all trying to figure out how to include, generative AI in clinical pathways. That wasn't a thing we were talking about, not just because ChatGPT wasn't there, but because people didn't actually consider that a possibility. So I think it's actually changed the possibilities.
Jake?
I agree. And I think I can speak specifically to mental health because that's really the only thing that I know. In mental health, it's been a net positive. I think Headway and companies like Headway have meaningfully increased access to care. And people who had been sidelined by the cost of care can now come off the sidelines and get access to care. And that wouldn't have been possible, at least not at the pace and the scale, without venture capital and without the technology to make it easy to accept insurance and verify benefits automatically and create price transparency for consumers. So it's certainly been a net positive in my opinion. I think what we've seen of late is sort of a gravitation towards like fundable and backable ideas, perhaps at the expense of like where there's real need in the system. So there are a number of companies that have sprung up that are doing pretty much exactly what Headway's doing. And there maybe are too many companies doing exactly what Headway's doing because there probably don't need to be 5 or 6. Sure. And I think what that's meant is marginalized and neglected populations have remained marginalized and neglected. So who's building for Medicaid? Who's building for the acutely mentally ill? I think we need to see more funding and capital unlocked for those segments of the population for healthcare to transform sort of in the next chapter.
Really, really powerful messages. I loved what you said there, which is changing the picture of what's possible. You also mentioned Gen AI, and this is a community of technologists and builders. And I want to ask, we sit at a moment where there are a number of megatrends that are hitting the healthcare system: value-based care, virtual care, GLP-1s like Ozempic, and Gen AI. And as entrepreneurs yourself now, which of those megatrends do you believe are most real, and which one of them do you feel is most hype? I'm going to kick it to Jake first.
So I don't want to sound like a Luddite because I do believe in technology. I think I'm probably going to be skeptical of what's easiest to be skeptical of, which is generative AI, especially in the mental health context. When I hear it pitched as sort of a supplemental tool for therapists so they can expand their reach in between sessions, that makes sense to me. when I hear it pitched as an eventual replacement of the therapist, that makes less sense to me. And that to me sounds more like hype. And that's mostly just because of my personal experience in therapy. Therapy's been transformative in large part because how well the therapist knew me, how much the therapist understood me. And maybe I'm just being sort of small-minded and nearsighted, but I'm skeptical that technology will be able to fully replace that. So that's the trend that strikes me, at least in mental health, is perhaps the most overhyped.
Okay, and the one you most believe in?
The weight loss drugs work. So I really believe in those.
Yeah. Okay. What can you say about that?
Yeah, the proof is in the pudding.
Me too.
Yeah, I think I kind of agree. I'm definitely a technologist and probably not a Luddite, but still, I think replacing doctors with Gen AI or replacing any of the regulatory stuff with Gen AI sounds very much like driverless cars, which in theory sound great, but still don't work because humans are way too complex. But what I do think is very possible is to automate away some of the inefficiencies. So I think all of the things about like finding drug interactions, that's probably real. I think anything to do with like assisting customer service stuff, that's probably real. Anything to take like random set of ICD codes and explain that to you in real English, that's probably true. I think there are like smaller use cases that are probably going to get more prevalent, and I think it's like really interesting that we talk about Gen AI, but we don't talk about our iPhones very much because there's tons of AI in the iPhones, right? And I think it's going to show up in like smaller little pieces everywhere. It probably big ones make a lot of noise. I'm not sure if there is a silver bullet there yet.
Yeah.
And more importantly, I think the underlying data that people are dealing with is like the elephant in the room nobody wants to talk about. So it is not great to make a decision about things based on data. That is just not great.
So just to play that back, the generative AI stuff, the big, bold, hey, these models are going to change everything about the way we interact with the health system, maybe not, but some of the more specific sort of, maybe you could say point problems within your companies, you could totally see it changing. And with that, I would actually love to ask you both, you're drawing on your experiences in your previous companies in the healthcare, in the healthcare ecosystem, Oscar and Headway respectively. If you had to go back and think about the problem that most irritated you, that problem where you were like, man, I would really love to see someone in this audience solve this problem for my company. Can you tell us what that would be? Where tech would have made a difference and you would have loved to see a young, hungry SPC person out there solving it?
I think there are a lot of young, hungry SPC persons trying to solve this problem. I keep going back to healthcare, at least all that I have seen. It's too many people wasting too much energy. It's like one of the few places you add tech and it causes more people to be added to the equation. So I think the people who are there are extremely smart. We just don't give them we don't give them good tools to actually do their jobs to the top of their license. So I think anything to do which eases their job is probably a good thing. From my perspective, it has everything to do with like member experience, everything to do with provider experience. If anybody can please solve the point of service payment thing, that'd be pretty awesome. If you can also tell me what my cost is as I walk into the doctor, or like if there's an app that I can use that's like automatically tells me don't get your blood work done in this hospital, go drive 5 miles over and get it there, that'd be pretty awesome too. Or anything to do with like where I can just write an English sentence and say things like, is this covered in my plan? Like that'd be pretty awesome. Thank you very much. Please tell me. I'd like to be a beta customer. Yes, I would love to do that where it's like, it is like, it's, I personally, being in this space, will not sign up to do medical services, not because I don't believe in them or I don't think I need them. It's just too hard to schedule one. So it's just too hard to schedule one, too hard to figure out what's covered in my plan and what's not.
Yeah, so experience problems.
Make it easier at the last mile for the consumer.
Yeah. Jake?
Can I give a cop-out answer?
Sure.
So my interpretation of this question is like, what's worth building?
Sure.
And I hesitate to tell people what to build because I think the things that should be built are things that you have like close proximity to in your day-to-day life. So like Headway worked for me because like I was anxious and depressed and my parents worked in the field and like I could do user research at home and I had a lot of empathy for the problem and for the providers. And I think if you're trying to start something and find something that's worth starting, it probably makes sense to sort of begin by looking at like, what are your experiences today that suck? I think, I got some good advice when I was thinking about this next startup to start. I eventually leaned on my experience in the classroom, but as I was like pre that, someone was like, use this thing called "it sucks that" statements. This is not that profound, but like think about things in your life that suck and then write, "it sucks that X, Y, Z." And that, generates a fairly comprehensive list of problems, some of which shouldn't be businesses, some of which maybe should, but all of which come from you personally.
I don't think that was a cop-out answer, but I'm definitely going to ask harder questions. So I want to dive into that and really start to talk a little bit about the early stage journey because, as I said, many of us are early in trying to figure out where we're going, right? And in your answer there, you mentioned that focus on the personal problems, focus on the places where you can understand the experiential issues. And you talked about your experience with therapists, right? Once you've understood that issue, and let's say once you've even identified a solution, hey, we should have a matching platform, of which I'm actually a customer and I love.
Oh, nice.
How do you actually get the incumbents or the participants, like providers and therapists and insurers, to actually listen to you and play ball? How can you actually sell to them?
For sure. So there's the question of how do you acquire the therapist, or how did we acquire the therapist? And Molly Murphy's in the crowd. Molly was one of the earliest employees at Headway who acquired like our first couple thousand therapists. So shout out to Molly. So there's the question of how do we acquire the therapist, and then how do you work with insurance companies? Most insurance companies aren't like Oscar. Most insurance companies are difficult to work with, and the startup graveyard is packed with companies that have tried to sell into insurance companies. And I think we were aware of that early days at Headway. And we actually spent time thinking about how do we not sell to these companies. And we realized that we're a group practice. Insurance companies have worked with group practices for decades, and they have existing operational channels that you can enter their networks through, where your counterpart is a network rep. It's not like a medical director or someone who has P&L ownership. It's not a sale. You just apply to join the network, maybe you get a slight increase off of their rack rates, and then you're in a matter of months. And that's what Headway did. And once you're in, you can start collecting data, you can start demonstrating outcomes, and you can start having tops-down conversations with plan leaders that do ultimately translate to exceptional treatment. But if you start there, you're probably going to fail because you'll run out of money before they start listening to you. So I think like the generalizable thing there is like try to present to insurance companies as something that they're used to working with. And then, this is also not profound, but like make sure you're solving a problem for them. We learned early days that though generally there was a shortage of therapists, there was an even more acute shortage of psychiatrists. And with just a handful of psychiatrists, we would actually stand out to insurance companies and to that network rep. So they would give us 10% rate enhancements instead of 2% rate enhancements. So making sure you're really solving a problem for them is an important part.
Okay, so looking like a familiar face, going through those existing operational channels can be a really, really strong edge.
Right.
How did you actually acquire those individual psychiatrists? Because trust me, I've been trying to talk to a lot of doctors and it's not easy. So how did you go about doing that?
First we did it poorly because we treated therapists kind of like a monolith. And then we realized that therapists are actually very diverse. There are therapists who are therapists, there are psychiatrists, there are folks who are newer to practice, folks who already accept insurance. And so the sort of fundamental thinking was, what about a therapist would make them more likely to want to join Headway? In early days, we landed on tenure in practice. So we realized that the longer someone was in practice, the less excited they'd be about Headway. Or the flip side is the newer they are to practice, the more excited they'd be about Headway. And so that was our target audience. We got really narrowly focused on that segment of therapists. And then, fortunately, Psychology Today existed. And Psychology Today is as old as it sounds, but it is the predominant way that people find a therapist online. They have like 350,000 therapists all across the country with profiles. Those therapists are very discoverable. We believed that we had a compelling value proposition, so we just deployed some cold outreach to therapists. We were able to get them on the phone. We extolled the virtues of Headway, and because we were free, they were much more inclined to say yes. But I think we learned something really critical in those early calls, which is that our product on the supply side was like perfectly tailored for a referrals program because therapists know other therapists. It's like a relatively quick time to get value out of the product. And they were really excited about it. It was a novel concept. So we were able to take an outbound call, convert that one therapist, and then have that translate into introductions to 3, 4, 5 other therapists. And referrals became, Molly, is it still our best channel? Yeah. Still our best channel. Referrals was really important flywheel on the supply acquisition side.
Got it. So you figured out your initial channel of getting to them by talking to them through Psychology Today and finding their information, and then you found the real growth channel, which was through referrals.
Yeah.
Okay, got it. And so then, if you had to go back and do it again, right, in those first 2 years of starting your company, what's the one thing you wish you would have learned faster?
There's so many things I wish I would have learned faster. I think the first is not actually specific to healthcare. It's just more generally about operating. And it's a piece of advice that I got from my co-founder, who I think got from like a podcast with Frank Slootman, who's the CEO of Snowflake. And we were all sort of like struggling because we were doing too much. And my co-founder pulled me aside and he was like, hey, the only way to both increase the speed and the quality of your work is to narrow the scope. And I realized that I had generalists on my team who were responsible for 5 or 6 different things. And in that moment, I realized that that's not the right way to scale. I think a lot of startup employees wear multiple hats and wear that as a badge of honor. But if you're managing a team at a startup and you have people on your team doing 5 or 10 different jobs, inevitably they're not going to be able to do any one well. And so it wasn't until I embraced sort of like both that mantra of narrowing the scope to increase the speed and quality, and also sort of thinking about my organization more like a factory and sort of managing a factory line, then I was able to actually scale faster. But I wish I made a number of mistakes related to not really internalizing that.
Very interesting. That mention of scaling is the perfect transition for me to switch gears and talk to Neetu a little bit. And I want to ask you, Neetu, you before joining Oscar as a VP of engineering, you were the CTO of a successful B2B company.
Yep.
Outside of healthcare. When you entered Oscar, what was your first, and this is an unfiltered, unrecorded talk, what the fuck is happening here in healthcare moment?
Yeah, I think I have continued to have those moments throughout my whole time at
Sure,
Oscar,
yeah, fair.
and post. I think it's very, very, very important to recognize the context, I think, in terms of like when Oscar got started. Actually, let me just give you some examples. The amount of money Oscar spends on paper is the same amount of money they spend on AWS. So just let that sink in for a minute. And there's nothing Oscar can do about that because it's a regulatory requirement that anybody can ask for paper plan documents, paper provider directory, paper whatever, and everybody has to have an ID cards, and you can't force everybody to take a digital ID card. So like, just let that sink in. It's like amount of money spent on paper is the same amount of money spent on AWS, and it's a tech company. So like the whole 1.3 million members are supported by a tech stack that's built at Oscar so that the AWS spend is not small, it's very large. So that was one. Oscar also used tools that weren't designed for workflow management and self-hosted all of them. I have some Oscar colleagues over there. So, for example, they actually use RAID for a whole, sorry, not RAID. It's a Microsoft version of Jira. They use Jira for a bunch of like workflow management tools. And you walk in there in 2020, it makes no sense that they would have self-hosted Jira for running, various different workflows across the whole company, everything on operations. However, you think about when the decision was made. It was made at the time that there was no BAA compliant, HIPAA compliant tool that you could actually do something with. So if you're starting in 2014 and you need an operations thing, I think it was brilliant that they said, oh, I'll just host Jira and run my own thing. Come 2020, it doesn't look so great. So that was one of them. But I think there are like numerous of those examples where the decisions that had to be made because you had to make the tools fit the current tech was very different from what was actually possible outside of a regulatory industry. And there were like numerous of those in terms of tech, in terms of just how things work. Yeah.
Those are really powerful stories because they point out sort of that germ of truth, or that the context is so crucial in healthcare, right? And anybody entering the industry might not know that, oh yeah, paper explanations of benefits are required. And there are a large portion of people in this country who may be accessing ACA insurance through Oscar who need that, right? Who may not have the tech literacy, or may not have access to some of the things that the builders themselves believe or take for granted. And that context is crucial. And so to flip the question, when you think about, okay, I'm now at a large health insurer that is scaling, what was a scenario where you could actually really improve on an existing healthcare process and outcompete the industry standard?
Yeah, so let me give you an example. Like in 2021 into 2022, 2021. I'm sorry, I'm looking at Zoran because he was there for this fight. So in between 2021 and 2022, the open enrollment period, we assumed that we were going to hit a number of new members. We doubled membership. We doubled membership from 500,000 to 1 million. Then in like one open enrollment period, which was probably 50 or 100% more than we actually expected to have. So now you're a tech company who is about to have scale of having to pay claims for like a whole bunch more percentage of members than you actually expected. And you immediately have to go figure out how am I going to scale everything. So you take everything, you make an inventory of every system, and you just do a giant test. And for like between Thanksgiving and Christmas that year, I don't think anybody in the tech team slept. No product manager, no designer, no operations person, no engineer. Nobody slept. We just like scaled. And the benefit of all of that is if you're buying the tech to run your insurance company, you're paying a PMPM cost per member, per month. And if you double your membership, you immediately double your tech costs. We did not double our tech costs at all. We spent a lot of time between Thanksgiving and Christmas, but then we maybe increased our AWS cost a little bit. But everything else was fine. Like we spent a lot of brain power, we spent a lot of sleepless nights, but we did not double our PMPM costs, and you can't get to that unless you had the 8 or 9 years beforehand building a bunch of stuff that you had full control over. During that time, these are the things that failed. We reached out to all of the large consulting companies, name one, and we probably reached out to them for help, and they were all scared, and they basically told us, no, that this can't happen. It did happen. We reached out to various TPAs, as in third-party administrators, to try and see if we could just like fold that stuff in. It was going to take us longer to get that implemented versus just scaling out our own system. These are things you can only do if you actually own your code and own your software. And there are like probably numerous examples like that. We put out a virtual primary care plan in like 8 months. We multi-tenantized and added a new client onto our platform in 8 months. So like, I think there are like numbers, like the degrees of freedom you get to like think through just goes up dramatically. We can add a new insurance plan in less than a month probably, as long as it's not too different from what it was. So, like we added Oscar added a COPD plan this year, and that was a pretty small build for us. I think the regulatory filing for adding a COPD plan was longer than actually adding on the tech side. We can add a new market with configuration. These are all things you can only do if you own the plan.
If you've built the muscle.
Build the muscle, own the tech, and know how to operate it.
Yeah, it's really interesting to see how both of you are describing how with that sort of technology mindset and that iterative approach, you can do things that no industry incumbent would say is possible, right? I'm sure a lot of group practices were sitting there and saying, we can't figure out how to get psychiatrists, but by taking that nimble approach and thinking about, okay, how can we actually reach them in the right way, you got to them. And I know United and Cigna would be falling over themselves trying to add as many members relative to their size as you did. And it's very impressive that you're able to do that. And I think that segues again very neatly. Look at this. This is so lucky. Into talking, I think, about one of the core truisms of healthcare, which is that it's actually a services industry and not, if never, a technology industry. And the stereotypical examples of that are providers make more money by seeing more patients, not necessarily by reducing their spend on their EHR or anything. They just want to see more patients. Payers make more money by insuring a lot more people, right? And I want to start first by asking you, do you believe that industry truism of healthcare is about services and not technology is true? I'll kick that to Neetu first.
Absolutely. It's about serving people. But I think where technology can very much help is how you go about doing it and how much energy you spend and what economies of scale you can drive. And I think that's where tech can add the most value. It can add economies of scale, it can add optimization, it can reduce inefficiency. Those are the places that I think tech can help. If you believe the giant Gen AI models, maybe it can help make even providers more efficient. I refuse to believe that we'll replace providers. But yeah, I 100%.
What do you think, Jake?
I agree.
Okay.
Yeah, I agree.
So having said that, then, that this is a services industry at its core, and that technology is a facilitator, but not necessarily a value creator on its own, how did you identify and approach it from a product roadmap standpoint, right? From that product roadmap of saying, like, hey, this is the services use case, and how do we then layer in technology? How did you do that in your companies to make that a part of your DNA, to say that in a services industry, we can thoughtfully implement technology in a value additive way? I'll kick that to you, Jake, first.
Yeah, I think the therapy product doesn't suck. Like, being in a room with another therapist where they're delivering therapy, like, that is not a broken product or process. What was broken was, how do I find a therapist? How do I know if a therapist is a good fit? On the therapist side, the entire prospect of accepting insurance was an administrative burden they just couldn't take on. And so we thought about what technology needs to be built to enable this service, to scale this service to the millions of more people who would benefit from it, but who are currently prohibited from accessing it today. So on the consumer side, that meant, people shouldn't make a purchase decision without knowing how much the thing's going to cost. And so that meant building like price transparency and immediate benefit verification to enable more people to access that service and to understand how much it would cost. People should be able to use a contemporary search experience to filter by therapists. I want a therapist who's talkative. I want a therapist who is going to ask me questions or tell me about themselves. That should exist. And so we built that, all in service of getting more people to the service of therapy. So we just thought about, like, what technology is needed to enable the consumer to easily access therapy, the therapist to easily accept insurance.
How can you build technology around the core service that doesn't suck?
Yeah.
That makes a lot of sense.
Yeah.
What about you, Neetu? How did you do it in this larger context where you were coming into an environment where there are already tons of engineers and you already have a health insurance plan? How did you guys think about that?
So I have a couple of different thoughts around that. One, Oscar has an NPS of 42. Oscar Experience has an NPS of 42. In any other industry, that is a terrible NPS. In healthcare, it's awesome because the regular industry average is like 2. So I think, like, relatively speaking, that is interesting. However, I think healthcare in and of itself is like an extremely weird industry where the consumer themselves have absolutely no power whatsoever. We all pay whatever we have to pay. We don't get to pick which doctor. We don't know which doctor is good. We don't know how much anything's going to cost. We don't know if it's actually going to work. Like, it's really, really weird. And that, for me, is the primary driver for trying to solve something. And I think if technology can make offering all of the services more efficient, it will cause more competition in the market. And I think not only just like offering the services can actually be efficient, it's actually shifting the market to have it have more competition in it so that we have more choice. So taking it all the way back, it's all about consumer experience. It's all about provider experience. It's simple things like, not only did I pay the provider correctly as an insurance company, I can actually explain what the bill means and why it was rejected and why it was not rejected. Putting things in the member app to actually explain what the particular cost of a particular service might be, helping them find doctors that are more aligned with their values, like culturally competent care is a thing that you can do. So there are like all of these like small things that you can add to make the experience a little bit better. Fundamentally, I think we need more choice. I think we need more choice. I think we need some purchasing power. That's what I think we fundamentally need.
Very powerful, very powerful. It's basically this notion of having that experience notion, this shouldn't suck, so what can we do to make that possible, is at the core of the, you could say, Oscar product philosophy.
That is the Oscar product philosophy.
Look at that.
Yeah.
I just figured it out from what you told me. I want to conclude this sort of section on, the early stages and scaling by talking just about who technologists should be spending time with to understand that context. We have spoken about your personal experiences. We've spoken about how, you, Jake, you had the people you wanted to sell to in your home, and you learned a lot from them, I'm sure, about the challenges of running a practice and seeing patients and making that experience possible. And when you see aspiring technologists who want to get into healthcare, who is the persona of person that you think they should be spending the most time with? Is it just to understand that context? Is it the physicians and the nurses who are on the front lines? Is it the patients themselves? Is it the administrative executives who, to some degree, make a lot of the system level decisions? What's that one persona that you'd really encourage people to invest time into? It's hard, I know.
I'll give you another sort of what probably feels like an elusive answer.
Okay.
It totally depends on the context and what you're trying to build. I think far and away the most valuable time you can spend is with a potential customer. So if you're trying to build for a new EHR, talk to doctors who work at hospitals. Go get them coffee. Learn about what sucks about their current EHR experience. If you're trying to build a better EOB tool so that people actually understand what their explanation is, like go and talk to people who have gotten their EOBs and be like, what about this doesn't make sense to you? Is this a frustrating experience? Why? Just talk to as many customers as you can so you can develop empathy and an understanding of their problems so that you can actually know if it's worth solving and then be informed on how to solve it.
I'm going to push you on that.
Okay.
I'm going to push you on that because let's just take the Headway example, right? Like you could have sit there and you could have talked to a lot of patients and you would have quickly understood, okay, finding a therapist sucks, right? But then you had to talk to psychiatrists and understand what their challenges in accepting insurance, and then you had to talk to the insurance executives, right, to actually understand, well, what would make a group practice differentiated? And I'm sure you talked to different people of those people at different times according to whatever point in your customer lifecycle it made sense, right? But how do you prioritize that, right? Because there's a difference between who's the easiest to talk to and who's the most important to talk to, especially in healthcare.
100%. And Headway is a three-sided marketplace. So you have patients, payers, and providers. I think this was advice that we maybe got from Alfred Lin, who sits on DoorDash's board, which had an equally, probably even more complicated business with drivers, Dash, like all these D words. And Alfred, I think, told my co-founder at DoorDash, they chose their customer. They had a company value that said something like the Dasher is our customer. That doesn't mean that they completely ignore every other constituent in the ecosystem. It just means that they dedicate most of their resources to building for this one constituent. We made the same strategic decision at Headway. We had a principle that said the therapist is our customer. We made that decision because we thought therapists were the linchpin of delivering on our mission of making care more affordable. If we could convince therapists to accept insurance, we would be delivering 10x more affordable care to patients. So we wouldn't need to build much for them. Like that incrementally affordable care is enough. On the payer side, we knew that they just wanted more therapists, and so it made a lot of sense for us to strategically focus on the therapist as our customer. And like 80% of the company's resources were allocated to that.
So grounding yourself in that persona and in that experience is kind of how you made that prioritization.
But also in the strategy, right? Like, we thought strategically whoever wins this market will have built the biggest network of therapists. And so we intentionally chose to focus on just building for therapists.
Okay. And so then I'm going to kick it to you, Neetu, and ask, okay, so that point of strategy, right? insurers sit at a really challenging part of the healthcare
Yeah.
system, right? They have to be the ones to help access care, but also deny inappropriate care, even though they may not be the provider themselves. And they have challenging strategy questions, right? Which markets to enter? Where do we want to offer, our services or our experience, right? And with all of that complexity, how did you at Oscar ground yourself in that patient persona? Looking back, what did you say you did?
I think for health insurance companies, there are definitely like three big key people to pay attention to. There are the providers who are part of the network, and the great relationship with providers always helps because you are now if you have a great relationship with your providers, you actually have a great relationship with your members, and so that's an indirect relationship. And the next one is directly with the member, and the third one's actually like brokers, right? So how do they even get access to it? So it's a bit of a three-sided wheel of providers, members, and brokers. So you can distribute the care, you can improve the quality of the care, and you can have direct member experience that is going to help the members find the care, help the and be able to have a relationship with the members to guide them into the right set of things. And then we can say a whole bunch of negative things about insurance companies in general. However, I think the very important thing inside is looking inside out from an insurance company, or even looking at the healthcare market in general. You have to follow the money. You have to figure out who you're adding value to, how, and if you take Medicare Advantage as a model, it is one of the few places where actually keeping people healthier is also happens to be one of the most profitable things to do, because they don't go to emergency rooms. They access care. They're available. You can actually reach the members when they need it. So build it for the members, build it for the providers, and build it for the brokers on the outside. Internally speaking, so there were like two phases to what we did at Oscar. There was like the external facing things, and then the internal facing. That's all about operations. So can you actually operate as a really, really efficient company? And I think this is one of the valuable reasons Oscar's going to be Oscar's going to probably hit profitability this year. And I'm not saying anything that isn't publicly available. You can go listen to you can go listen to the last earnings call. But I think Oscar's going to be profitable because they have the ability to improve operations. And we had teams who would sit right next to the claims processors. We had teams who would listen in to the member experience, the member CRM calls. It's pretty standard like software stuff where you have the product manager sit next to the actual customer and do it that way.
I think we ended that question in a good place. It sounds like in the strategy of Headway, grounding that therapist experience, solving them, and having that as your market perspective, saying if we solve this, we can solve problems for everyone else was really powerful. And in Oscar's case, moving past that complexity of health insurance to say members, brokers, and providers. If they're happy, we're happy.
Yep.
Okay, so with that, I want to close out this portion of the conversation before we turn it over to audience questions by asking you all to look back and reflect a bit, and on which I've already done for 40 minutes, but just a couple more things here, and that is on how you understood the complexity of following the money, to use your words, right? When you look back, or when you think about your experience starting a healthcare company, there is a lot of regulatory complexity and just straight business model complexity, right? So Jake, to start with you, how did you what was most helpful for you in understanding that? Lawyers,
yeah. I mean, it is a very opaque landscape. It would have taken me a year to learn it entirely on my own. We had the benefit of having raised money, which meant we could afford some of these absurd hourly rates. And so we hired lawyers who were regulatory experts. We tried to make sure they were commercially minded regulatory experts, and they were sort of flexible in their thinking, because I'm not sure we followed every single regulation at every single moment to the exact way it should have been followed. So, but yeah, the short answer is like, pay for the expertise.
What about you, Neetu? What was most helpful for you in that regard?
Yeah, I arrived at Oscar in 2020, so 6 years after. I can tell you the history piece as I've known it and like what I experienced post. So, yes, buy the expertise. So you and I think that brings its own set of challenges. If you put real healthcare experts next to real, headstrong technologists, you're going to experience fireworks. So there were lots of fireworks, and I think, but they stuck together, and I think that was pretty important. As in, like, you bring a bunch of experts, you put them in the room, and you basically demand empathy, and so that was important. The other thing, like, Oscar started in 2014. There were tons of times it did not go right. Like, I think at one point before my time, I've heard of MLR being over 100%, and like, if you don't know what that means, it's like, that's really bad. Come find me later and I'll tell you. But MLR over 100% is really bad. And I think since then, it's very much like, let's go try something really big. Let's make sure we learn everything from it. Let's not risk the members. Let's not risk the providers. But let's try to risk all the safe things to risk and then go after it. And then add expertise. Oscar had Oscar still has a very great legal department with tons of regulatory expertise, and that's just par for the course. You need, as an insurance company, you need to figure out reinsurance, you need to figure out regulatory experience. If you're a public company, you need to figure out all the public company things, and you need to figure out if you're building software for healthcare companies, too bad for you, SOC 2 and SOX are just part of what you're going to do, and HIPAA compliance is part of what you're going to do. So these are just all par for the course for building in healthcare.
They truly are, yeah. All those acronyms and
Yes.
all the legalese that you have to figure out. So for the last question here, before audience questions, obviously your personal experiences were really meaningful to your initial journey into healthcare and into starting the businesses you're starting. As you think about your next companies, can you tell us the personal or patient stories that inspired you to start the current concepts you're working on? I'd love to hear from you, Jake, first.
Sure. So I was a fifth grade teacher at what's called a Title I school. So that meant every kid qualified for free or subsidized lunch because they all came from low-income families. Basically, every kid in my classroom, as I mentioned earlier, struggled with something mental health related. And there were two instances where I actually went to the school counselor's office, accompanying a family and their student, looking for care. Saying, hey, for many families, the school is the safety net, and so that's where they go when they decide that they want help. And the school counselor was responsible for all 700 students in the school. And the best that she could do, which is what she did, was in the first instance, she gave the family a physical PDF of community mental health clinics and said, hey, call down this list. We made a few calls, each had at least a 3-month-long wait list. In the second instance, she just said, I don't know of any psychiatrists who accept Medicaid. And so that kid didn't get help. And that was unfortunately representative of the broader problem. You have teens who are growing more and more mentally ill. Last year, 10% of teens attempted suicide. 10% of teens attempted suicide last year. And at the outset, they struggle with things that are treatable, but they have no access to lower levels of care. And so their condition degrades, and then they go to the only place that they know will take them, which is the emergency room. And I'm sure everyone here has seen an article about emergency rooms being inundated with teens who end up staying for months because there's no place to discharge them. So what we're building is more access to lower levels of mental health care for all students across the country. Whether you're on Medicaid or you're commercially insured, RISE, which is the name of the company, will offer services. And our belief is that we can help these kids who are struggling with treatable conditions before they decompensate, before they end up in the ER, before they attempt suicide. So it was those experiences in the classroom that just made me aware of this. It wasn't really even in my orbit until I saw it firsthand.
That statistic is shocking.
Yeah, it's staggering.
It's like, it makes you sick. Yeah. Well, Neetu, you're gonna have to follow that up. I know. I don't know what to tell you.
Yeah. So I'm gonna need a minute. When I was at Oscar, one of the things that was the most attractive or most kind of stood out to me most, and it seemed normal to me outside of the healthcare space, but doesn't seem to be at all normal in the healthcare space, is all of the data that flowed into the organization at Oscar flows into one spot. So there's always a single source of truth you can go to. You can ask questions and drive like insights. So if you wanted to know what is the current high dollar claim list, you can go ask a question. It's a little complicated than that, but you can still go to one place and ask a question. If you wanted to see which members are likely to be the ones that are going to cost us the most and how we help them and what kind of things have happened to them so that we can like maybe put a case together and help them, you can go to a place and ask that question. That place doesn't exist for almost every health insurance, other health insurance company. They maybe had something like 20 years ago. They probably have an on-prem solution. So as I was thinking about like what is the thing that I can do after Oscar, and I thought of all of the edges of things, I figured it would be pretty hard to do things like get eligibility information, get plan information, get accumulators, get their current like out-of-pocket costs, what's covered in their co-insurance. These are all things that are going to be really hard. So what we're building is a solution to help normalize and aggregate all of that data and then make it available as an analytics tool for inside the health insurance companies as well. So like if you're a quality expert or a stars expert, you can actually just go to a dashboard and see, this is what my stars performance is likely to look like now. Here are the things I should pay attention to. Here are the things I should ignore. For now, and here's the set of actual number of people I should go call to go get their breast cancer screening, go get their colorectal screening. So we're actually trying to normalize the data that flows inside the organization and solve some of the complexity inside the organization so it can enhance all of the other things as well.
Yeah, that pool of data is certainly not in one place, and
No.
the answers you get boggle your mind. How do you not know what your business is doing? Well, we don't know. You know, what can I tell you?
Yeah, it's a layered problem, right? Like they are not most health insurance companies are not software companies. So the amount of money you need to spend on a software team versus the capital investment that you need for software before you reap value from it is not conducive to their business model. So.
Well, thank you both so much for answering my questions and dealing with me. I want to turn it over to the audience here. Does anybody here have a question? I'm sure. Right there.
So how do we keep the patient at the center of all the decisions that we make? I think we tried to be very aware of how we knew if we were doing right by patients. Because not every decision can be made with the patient at the center of it. In fact, at Headway, as I said, our strategic focus was on the therapist. And so we believed that by virtue of focusing on the therapist, we would do patients a solid. We were offering them 10x more affordable care. But it's not enough to just rest on that. You need to make sure that you actually have metrics that you're checking regularly to ensure, is the care that's being delivered quality? Are you reducing symptomatology? Are people getting less anxious? Are people getting less depressed? And if they're not, you then make a different decision. Maybe you kick the therapist off or you investigate further. But they were sort of on the periphery. And that was a strategic decision that we made.
A follow-up question. Were there ever times where a misalignment caused actually a negative patient outcome?
I'm sure. But try as we might to deliver an excellent experience to every single patient, if you do something at scale, inevitably some experiences are going to be subpar. I think what's important is that you're earnest in your effort and you remediate things quickly and you close the loop with the person who had a bad experience. But yeah, that inevitably happens. Happened on the therapist side too, despite focusing a lot of resources there.
One more follow-up, I'm sorry. For the company that you're now building, who is the customer?
The school counselor. So we think school counselors are the gatekeepers of referrals for students, and if you can build for them and you can lock them up, you win distribution and you can win the market.
Next question. There.
Hi. For both of you, today, what's your missing for this new company? What's the missing key or missing people? You both mentioned, or some of you mentioned it's okay for a lot of people in the room. What are you missing right now?
Product market fit. Go ahead, you can answer the question.
Yeah, customers.
We are.
Yeah.
Um,
I can answer it a little bit more honestly, or more fully. Like we're thinking about what do we need to prove to find product market fit, and there are people that we need to hire to help prove those things. And so we're focused on two discrete hires. The first is an engineering hire, and then the second is a clinical hire.
We're a little bit further down the road. We're probably going to finish filling out that portion of the team in the next little bit. So for the first phase, I think we'll be like internally kind of fully staffed, but definitely need customers.
Alrighty, one question right there.
Both very technically minded founders, and you've both gone 0 to 1 or -1 to 0. Can you talk about how you think about identifying the most commercially viable idea and the tests and iteration, and how you actually know when the right time to dig your heels in and invest the time and effort to build a business is?
It's hard to know. I think like what we did this second time around was just like documented what needed to be true for us to commit to this direction fully. And so we needed to feel confident that we would be able to acquire students at a low cost. And so we had conversations with counselors to understand how hard might it be to get them to use Headway, Rise. How many referrals might they make over the course of a month? And so through those conversations, in a relatively medium fidelity way, we developed a point of view on that risk. And we just had a number of other risks or sort of things we thought needed to be true that we just like systematically tried to evaluate through user research and I guess some tops down research as well.
Awesome. Oh, sorry, go ahead.
Sorry
about that.
I don't know that there is a very clear, rational answer for all of those things. I feel like I'm making decisions with imperfect data all the time. But here are things that were true, which is like I could no longer sleep without trying to solve this problem. Once you start looking for it, you see proof of like, yeah, this problem actually exists and it would be valuable to solve. And then for me, it just started like I'm this is truly like first real-time founder, not like experienced like Jake here. For me, it was very much like talking to people and just feeling rather lost for a while, but not being able to let go of it. And that was very important for me, as in like, oh, if I could saw it, and then I could no longer sleep without it. So
I think we have time for one more question right there.
Yeah, I've been thinking a little bit about some of the things you said, Jake, around like the most underserved communities with respect to healthcare and mental health care, and then also like on the other hand, the need to build something that is like commercially viable. And I was just curious if you could talk a little bit more about like the tension there. Obviously, like selling to school counselors, right? That's a choice to try and take a problem that's very much centered on an underserved population, which is like kids who are having crises, right? Yeah. But then to create it in a way where like there's an actual business to build there. So I'm just curious if you could talk a little bit about that tension, how you reconcile that.
Yeah, I think it's like, it definitely is a tension that exists, and you're probably going to be able to innovate faster to figure out a business model that works than relying on like a legislative change or like an increase in reimbursement rates. So I can just sort of walk you through how we're thinking about doing it at Rise, and maybe it's instructive. We knew that group therapy was as effective as individual therapy, but it's used 1/20th as frequently for administrative reasons that are manageable with software. And we also knew that individual therapy is an unprofitable service if you're billing Medicaid, and you need to bill Medicaid if you're helping teens, because teens cover 4 out of 10, Medicaid covers 4 out of 10 children in this country. So the sort of business model insight or the clinical insight is we should just use predominantly group therapy because that's the only way that we can actually give this underserved and marginalized population access to care while still building a business. You're not gonna actually help people if you aren't able to build a business. Yeah.
I think that's it. That's all the time we have. Thank you so much, Jake and Neetu, for joining and sharing your sage wisdom.